So what's a binge? What's a binge? So, a person says, I binge, right? Well, binging could be, watching 3 Netflix shows in a row, right? Or reading an entire novel front to back. So binging in the popular imagination is anything that you do a lot of it in a short period of time, right? From the point of view of a alcohol scientist, a binge is the number of drinks per day that you're supposed to have plus one. Okay. So you can binge for women at 3 drinks a day and men at 4 drinks a day. Okay. That can be a binge, right? Patients often don't mean that I had twice, I had a second glass of wine at a 6-hour party at a wedding. What usually is meant in the public mind is that you drink much too much and you're really intoxicated, and you have some consequence of the intoxication, right? Some consequence of intoxication. So the part of binge drinking that average people complain about, some of it's behavioral, right? And like knowing your triggers for engaging in feed forward drinking can be your first line of defense, right? I mean, if you're drinking 10 drinks because you're hanging out with a particular group of people, right, who also drink 10 drinks a day, well, maybe you need not to hang out with those guys or girls, right, for that period of time. There are medications that can blunt, right, drinking behavior, including this kind of binge drinking. Okay, so and binge, by the way, also often means to people heavy intermittent drinking. It means I had 10 drinks, but I don't do it every day. I do it once a week. So why do people binge biologically would be a more interesting question. So anyway, there are social things you can do to help control binges. And if you should, those are always the right first moves, right? Like don't put yourself in a place where those things are likely to occur. So why do people binge? Well, part of this is like just fundamental to alcohol and how it affects all of us. So we drink for the pleasure. We drink because it makes us feel good. It relaxes us. It makes us laugh at the joke someone else just told that wasn't all that funny. It makes you, like willing to get up and dance with someone who, like you might not want to dance, who you were too scared to ask to go for a dance. It makes it's a social lubricant that reduces stress and anxiety. Feel more like you can enjoy a social event, right? And you stop drinking, not because of any of those things have been solved or they're done or you did them. You stop drinking because you're having an adverse effect. You stop drinking because you feel full, you feel drunk, you feel tipsy, you start feeling nauseous, your words are slurring, your friends, your dancing is now terrible, right? And, and your jokes aren't funny even to the other intoxicated people. So the forces that drive people forward in their drinking are different than the forces that stop them, okay? So one of the basic features of people with an alcohol problem is that they do not have a high sensitivity. They have a very low sensitivity to those adverse effects of alcohol. So they don't really feel sick. They get all the way out to the point where they might black out before they realize that they've had too much, right? Whereas someone who's like the classic cheap date, and there's a gene for that called cheap date. There's that person is feeling nauseous after 1 drink, right? So it doesn't matter how much they want to relax, they're feeling nauseous with even a drink. So binge drinking is usually seen in the setting of people who have a low sensitivity to the adverse effects of alcohol, which is genetic, and in social situations where binging is where that heavy, intense drinking is tolerated. And interestingly, within that biology too, the beneficial effects of alcohol suppress some of the stop signal, right? So it's kind of like if the go signal was your accelerator pedal in the car and the stop signal is your brake, right? The accelerator pedal impairs the use of the brake. Even when you try to touch the brake, it doesn't work as well. Okay. So what can you do about that? Well, there are several medicines that decrease the pleasure, that stress reduction, that relaxation. right? That feeling good after alcohol. Naltrexone is the prototype here, and so it gives you a little less reward, and it also doesn't impair that stop signal. It prevents that stop signal impairment, that, so letting you get much more control over your drinking, right? And and patients will often complain, well, I didn't get as much buzz. Well, that's the point, right? You're not going to get as much, but you get the effect of that, sort of normalizes your response to alcohol, at least compared to other people. You're more similar to they are. There are several other medications that can help decrease binge drinking, and there are clinical trials for all those, and I'm not going to go over those right now. But if you're binging, it's because you have this risk, this low sensitivity to adverse effects of alcohol, and you're getting positive rewards from the drinking. And you need to address both sides of that puzzle, right? To really get better control over it, as well as the social circumstances and all the behavioral things that are fairly obvious, but sometimes actually need to be spelled out for people. Every time I go out with these guys, I do the same thing. Well, think about that for a minute, right?
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.